been topping up on my vitamin D in between emails and working at home, because I think, we've been trying through Healthy Hearts over the last few months to encourage people with good nutrition and good looking after our hearts and good exercise. And we've been blessed to have Dr. Hibbah and Dr. Alice supporting us with the nutritional aspects of this. And, they've encouraged us to take our vitamin D supplements, but also to look after ourselves and do what we can to help ourselves to get, to be well. And today's session really is a question and answer. So over the last few weeks, we've been having lots of questions put to us about health and health, and I was going to say the wealth of health. So we would like to give this opportunity to take this opportunity to answer some of those questions. So in a few minutes, I will hand over to Dr. Hibbah, who I will ask those questions, and we'll have a dialogue. Please, I'm encouraging you to pop your questions, any more questions that you might have during this session, into the chat box. We will endeavour to answer them today. If not, we may indeed have another question and answer session in the future. So without any further ado, I'm going to ask Dr. Hibbah to continue. Thank you.
Right. Thanks a lot, Karen. Good evening, everyone. We've had lots of questions. I've had some questions sent to me in my inbox because I have a social media presence. So I ask people to send me questions. So I have a few of them. So I think I'll get started with my questions, and then Alice can also, you can still type in the chat box whilst we start with the questions I have. Okay, so my first question reads, I've been trying so hard to eat healthy, but I'm still overweight. What am I not doing right? That's a very common question, people have, Alice. A lot of people, you hear people saying, I don't eat a lot. I'm eating lots of fruits and vegetables, but I just can't lose weight. So please tell us, what is the problem? Why are people claiming they're eating healthy and they're still not losing weight?
You know what? After practicing nutrition for a few years, 20 plus, I find that most people who are trying to lose weight or eat healthy, they know exactly what it is they're doing wrong. So I just assume this person knows exactly what they're doing wrong, but I'll still answer the question. You see, when it comes to weight loss, it's a lifestyle change. It's not that you stop doing something temporarily and go on a quick weight loss diet and come back. No, it's a lifestyle change. And so if you're talking about lifestyle change, then we have to analyze, what is it am I doing in my lifestyle that's affecting my weight? So they could eat healthy, but they're eating very small portions. That's number one. Because if you eat too little, the body is going to end up conserving the energy, because you need to have sufficient energy. And then you need to exercise to create a calorie deficit. So they might eat healthy, they're eating too little, and they're not exercising. Also, that's not enough. And that's also, just exercising alone is not enough and eating healthy. Some studies have shown that dehydration slows down your metabolic rate. So you might exercise, you might eat healthy, but your metabolic rate is still stuck. Why? Because you don't take enough water. Also, not sleeping enough, not having sufficient sleep also affects your metabolic rate. So you might eat healthy, you might exercise regularly, take enough water, but you're not eating enough, you're not sleeping enough, and this slows down your metabolic rate. So I can say that she needs to evaluate those areas. Is she eating enough, even though she's eating healthy? Sometimes you can eat healthy, but also eat too much. You can eat, fruits are healthy, but if you eat too much fruit, that is a lot of fructose, and so you end up taking a lot of sugar. It's healthy, but you're eating a lot, and so the body is just going to store it gladly. So it's always good. What I always tell people is work with a dietitian to help you identify where the problem is. Unless you identify the problem areas, then you might put effort, but then you don't get an outcome that you are happy with. I hope that answers your question.
Yes, because I've also had a question before in the past that says, is there anything like eating too much fruits? You know, because we're always telling people to eat 5 a day, and you know that's what we say here in the UK. So if people decided to just feed on fruits and vegetables, is there anything wrong with that? Just, you know, trying to go on a fruit and vegetable diet. I don't want to, because we don't encourage dieting, but yeah, the question was, is there anything like eating too much fruits?
Yeah, I'm sure maybe they haven't seen, but one of the sessions we had here, we showed how much sugar you can get from fruit and how much sugar you can get in different fruits. Let's just give you a regular banana of maybe 120 grams. A regular banana about 120 grams will give you about 6 teaspoons of sugar. So if you just eat a lot of fruit, you know, 6, 7, 8 fruits, then it is not, it is too much fructose. That is sugar that is directly absorbed by your body, and it is stored as fat. So you'll find that your excess calories can actually just come from your fruit intake. You've eaten, you've sufficiently taken then you go eat you go take a lot of fruits. So yes, we are told to have 5 fruits a day, but sometimes having worked with people, that doesn't work for everybody. I can let people who exercise regularly and exercise like very good exercise, high level exercise, and athletes, they can have up to 5 fruits a day. But Hibbah, I know me and you, we can't have 5 fruits a day. Eh?
No.
That's too much fructose.
Yeah.
We can have maybe 2 to 3 fruits a day, and then supplement with vegetables, you know, because we are not super athletes who are going to utilize that sugar. No. So the more sedentary you are, the less you should take. But if you want to take more food and still lose weight and not see it, you know, getting onto your chest or your bumps of your stomach, then exercise more, move more. And exercise just means moving your major muscles, your arms and legs. So move more, walking, jogging, running, but not sleeping.
Yeah. So I guess you've answered it correctly to us. Most of us within our communities don't exercise that much. So yeah, we shouldn't be taking excess fruits. It should be a combination of everything, all the 5 food groups. You have to have a bit from every one of them. Okay, there's a second question in the chat.
No, hold on, Hibbah. Oh, yeah. In relation to fruit intake, a lot of people also take juices, and they say, "Oh, but I take juice." Yeah. You see, what happens is you can't eat 5 oranges in one sitting, for example, because that's going to give you acid and you'll feel your tongue is irritated and you won't be able to take that. But it's very easy to take it in form of juice. Yeah. So when you blend fruits to take juice, you also end up eating a lot of fructose, and this you will be overweight. There's a time I had and the pediatrician next door to me sent a little girl in my office. The girl was like 2 years old, but almost, you know, like 25, 30 kilos. Like that was very, very heavy. And so the pediatrician says, I can't figure out what the problem is. You figure it out. So I sat with the mother and I listened as we did a dietary intake. And I just listened to her, and 5 minutes into the conversation, I knew exactly what the problem is. She blends fruits to give her daughter fresh fruit juice. But how many fruits was she putting there? She was like 4, 5 fruits. So in a day, this little poor child was having almost 10 fruits in juice. I mean, what do you expect? The child was really overweight. And that's all she had to do, remove the fruit juices and give a fruit or 2 fruits and water. And with time, the child lost weight. But of course, it was hard because the child was also already addicted to the glucose, the sugar, and the child threw a lot of tantrum. And, you know, I mean, I just told her, you have 2 choices: to give your child problems, because this one is going to be diabetic in another year. 3 years, she'll be diabetic if she continues like this. Or you manage the health of your child and give her a secure future. And they had to just be strict. And eventually the child she's now a grown girl, doing very well. You know, yeah. So she learned her lesson from that, and that was a child. But for all of us, it does that. So that person who says, "I eat healthy, but I don't lose weight," sometimes they take a lot of fructose, fruit juice in form of eating healthy, and so then the weight is just sitting there looking at you, and you're doing everything you can. So identify the problem.
Hi, so thank you so much for that question, Alice. It's, you know, and it leads on to a question that's just been asked in the chat box from Janet. And Janet asks, is too much fruit good for diabetic people? I think you've answered that question. So,
of course not. It is not good for somebody who's not diabetic. How can it be good for a diabetic person? In fact, sometimes when I have a new diabetic patient, maybe they've been diabetic for a while and only came to see me, and their sugars are out of control, the first things I cut out fast to get us control the sugar and then introduce it is fruit. I'll remove fruit from their diet. And then once they control their sugar, then I will introduce it back. So the difference between diabetic and non-diabetic person is that your portions matter. You can eat everything, but you have to be more strict with your portions compared to somebody else who's not diabetic, because everything you eat becomes sugar, and your body has no ability to utilize this sugar. You need glucose, you need medication, oral hypoglycemics, and you need or insulin to reduce your sugar. So you cannot eat as much fruit as anybody else eats. You have got to watch your portions. Thank you. Karen?
Janet, does that answer your question? If you need to ask any more, please, and I'm asking everybody, if you've got any questions, please do pop them in the chat box and we will try and get them answered today. Thank you. Hibbah.
Yeah, last week there was a couple of questions, and I told you we didn't have time last week. So if you want to ask those questions, but I'll go on to my next question that says, when we cooking rice, my mom always insists that we wash the rice several times to get rid of the starch. Is this really correct? Yes, I want to ask the nutrition experts. Yeah, I remember growing up, we had that in Ghana as well. You're told to wash the rice over and over and over again to get rid of the starch. Are we getting rid of the starch?
First of all, you're getting rid of all the water-soluble nutrients. So by the time you've washed the rice a few times, you know, you've lost your few water-soluble vitamins that's on it. And then you have washed out the polish, because rice is also always polished. That's okay. But the starch is that, you know, that mass, the weight, 1 kilo, that is the starch. You're never going to wash it away. It is right there. So it is, don't wash. Well, you need to wash your rice, but just wash it once. But what I've also had, Hibbah, is that people actually, they cook it and then they wash it to remove the starch. There is nothing like that. Yeah.
It's in the grain.
The starch is in the grain. You've just washed out the polish and you have managed to leach it of all the nutrients it could have had. So you're eating less nutritious rice. So the starch is in the grain. So unless you're going to pour out the grain and not eat it and eat only that little sauce that has come from it, then you'll be cutting down your starch intake. Yeah.
I think there's a question, but I think I once treated this topic, but I'll still ask. Can slim people get high cholesterol? I guess the point is it only overweight and obese people who can get high cholesterol?
No. Everybody can get high cholesterol. Looks deceive. In fact, there's a time we had such a good example. We went for a corporate awareness and we did cholesterol, like random, random cholesterol for everybody. And in that organization, we do about 16. The slimmest person had the highest level of cholesterol, and the biggest person had the lowest. So they're all unhealthy. One is overweight and needs to lose weight. The other one is slim, his cholesterol is high. So looks deceive. It doesn't mean that if you're slim and always slim, you need to eat unhealthy. You will build high cholesterol, it will clog your arteries, and you will get heart attack and die. So I find also when it comes to even just exercise, you find that actually a study that was done here in Nairobi, Kenya, where we are, they found that most people who are actually overweight made more effort to exercise as compared to thin people, because they think they're slim, they don't need to exercise. You all need to exercise, slim or no slim. So the fact that I look slimmer doesn't mean that I'm healthy. I need to be having a healthy lifestyle to actually say that I'm healthy. If you're not healthy, you'll still die of heart disease, You will can still get diabetes and high blood pressure and simply die. Just like men don't eat vegetables because it's for women and children, but they're the ones who get the most colon cancer. So I have a t-shirt that reads, real men don't eat vegetables until they get sick and die.
Yep.
So even for thin people, you have got to exercise. Otherwise, you will also just die from complications of cholesterol.
You know, when you talk about exercise and slim people, there's this story that I always share when I get the opportunity to talk about exercise. So I have a brother who is very skinny, but he likes to fit in Ghana. And he said he was going on one of his runs one day, and this elderly man called him and went like, "Gentleman, why are you exercising?" You know, like this man said it out of concern because according to him, you know, you're too skinny to be running. And that's a mentality most of us have. You know, we think that if you're not overweight and obese or you don't have a bit of flesh, you really are healthy. And so you shouldn't be exercising. Anyway, it takes me to my next question. Well, it's still in relation to what we are talking about. So why is it that, you know, that's something people have asked me in the past. Two people, one fat, one slim, both eat really unhealthy foods, and then some remain slim, others really remain. So what comes into play? What can explain those differences? Because we know people who eat lots more than, you know, so many obese people, they never get fat. Others,
yeah,
a little bit, and then they put on weight.
Very good question. So what happens is when it comes to being overweight and obese, genetics play a big role. So in this case of eating and not becoming overweight and eating a little and becoming overweight, there are two characteristics that play a role. One, we have what we call fats. All of us have fat cells, but some families tend to have higher levels of fat cells. So when you eat excess, your fat cells grow in size, and then they start to increase in size and number. So then you really increase weight because your fat cells can multiply and multiply and multiply. And when you lose weight, they still just reduce in number, but they don't reduce in number, they only reduce in size. And some families have very few fat cells. So whatever they do, they never grow fat. And that's just genetic. And the other characteristic of genetic predisposition is basal energy expenditure. You find that I'm sitting there with Karen. We are all breathing, doing nothing. I'm using very little energy. And Karen is using 100 kilojoules a minute, or, you know, like using so much energy. But that's just the genetic makeup. So she tends to use more energy, and I tend to store more energy. So we eat the same amount of food. I eat the same portion as her. I continue to expand, and she remains the same weight because her basal energy expenditure is extremely high, and just because of genetic makeup. But all this still, if you push a very thin person, studies have shown that your environment can actually push you to the limit. You can be slim, your family can be slim, but you can be exposed to high fat foods, and you can actually gain weight and shock everybody. Because when you push yourself to a certain level, the fat cells will just increase in number. And so then you should watch a documentary called Super Size Me, and you'll see. Yeah. Thank you. I can't hear you, you're muted.
Sorry, guys. Muscle energy is in the chat box. It says muscle energy expenditure. Is this also called nervous energy? Not sure what that means.
It was me that got the question.
Yeah, Karen, you want to ask that question?
You know, you were talking about sort of having two people sat together, they eat the same amount of food, but somebody is using more energy at rest than the other person. And often we say, oh, they've got nervous energy. So do you think that's what they might be referring to? The energy that they've not, you know, that this is something that happens ordinarily. I'm just asking, I'm you know, I have no idea.
Well, I've had that slogan. I've had a slogan, but I've not come across it as a scientific term. It's like it's just a slogan to say all your whole central nervous system is using energy.
Oh,
so, but I've not come across it as a
I don't
as a
know.
scientific term for describing that. Yeah, maybe it's there somewhere. Some more reading maybe to find out. Yeah. Thank you.
Does anyone else have any question, or I should keep asking those questions that keeps coming into my chat on social
Please continue
media?
with the questions, Hibbah. That's great.
Should I go on? Right. This is a very common one that I get. How many eggs can we eat in a week? I never even place a number on it.
Eggs. Okay, good question. People are afraid to eat eggs because they think that eggs give you high cholesterol. Yes, you have. When it comes to cholesterol, let me answer it from that point of view and then from the point of view of consumption of protein. So when it comes to cholesterol, we absorb a very little cholesterol, like let's say 20% of your body absorbs cholesterol molecules in our food, like maybe eggs, and your body makes 75% of your cholesterol. That means that when you take saturated fat, you take refined carbohydrates and other things, your body is going to use it to make cholesterol. So your body makes more cholesterol that it absorbs from food. Are we clear there? Your body makes 75%, but you absorb only 25%. So eggs have got your cholesterol and you absorb very little. And how much cholesterol is in the eggs? Actually, very little. So ideally, if you're somebody who does not eat a lot of meat and chicken in your diet, you can eat an egg every day. You can eat 6 eggs a week. And if they're growing and they have no egg allergy, because sometimes also if you eat a lot of eggs, you can get protein egg allergy for some people. So, but you can eat up to 6 eggs a week, even up to 12 eggs a week if they're in puberty and that's the only protein they have. But me and you eat meat, chicken, fish, then you can balance the protein that you take. Yeah. So you can eat 2 eggs a week, or you can eat 4 eggs a week, or you can eat 6 eggs a week.
I think I'll ask one last question, if there isn't any question here. I went to Facebook. This was a question that was sent to me. One Nana Fusua. She says, I have so many questions about foods. Okay. As a layman, how do I know how to know the nutritional value of the food I'm eating? How much I should eat mostly when the food is tasty? And what time should I take my last meal when house chores keeps me up till very late?
There's a lot of questions. Break it down.
If you want to just take one, and then because we don't have much time. I know you have another meeting.
As a layman, how can I know my nutritional value? As a layman, you can't know. That is why nutritionists and dietitians are there. So you can either go to some certain websites that are recommended and read, because that's the only way you're going to do, or get help from a nutritionist and a dietitian. So that's what I would recommend. Get help or read. Even still get help on websites to go to, get help on what articles or books to read. There's so many books out there, and so they can get help doing that. Then you can know. And it's always a very good effort for you to actually learn about food and how it helps you, because it saves you a lot. Remember, eating healthy is prevention. When you eat healthy and you have these chronic conditions, you also control them better. So it's a good investment to learn how to eat healthy.
Alice, sorry to interrupt you, but for people, in Greater Manchester and in the UK, this is the reason why we are doing these sessions, so people should also try and listen and engage. That's why we come on every week to do these educational sessions, is to provide people with this knowledge so that they can make informed decisions when it comes to their dietary behaviors. Okay, so this person is not here in Greater Manchester. This is someone in Ghana. So she cannot be here. Hopefully she would see this video. But for people within our community, that's the essence of all the education we are doing. We're trying to empower people so people can make the right decision. They can make the right choice when it comes to eating behaviors. Yeah. Right. Okay. Do you want to add one to it before we go? Just still from that set of questions. you've answered the first part. The second part says how much I should eat mostly when the food is tasty, and what time should I take my last meal when house chores keeps me up till very late.
How much you do it when the food is tasty? I think that is self-control. And like I said at the beginning, everybody knows what to eat, how much to eat, you know. So that is self-control. You need to just know that you need to eat the same amount of portions, whether the food is tasty or not. And of course, you have to be realistic. Once in a while, you can eat a little bit more than usual. It's okay if it's not a habit. But how much should you, what was the last part, please? Could you repeat?
Time to take the last meal when house chores keep me up till very late.
Yeah, I get that question a lot. But what I tell my clients is, first of all, you need to stop. You need to re-energize. If you've been working the whole day, you can't go on working until 10 and then eat your dinner. Stop, eat dinner, relax, and then continue doing some work if you have to, because the earlier you eat, the better the quality of your sleep and your energy levels in the morning. The later you eat, the poorer your sleep, and you will wake up not refreshed, and you'll be tired and fatigued. So if you know about the consequences of eating too late, then we need to apply that as much as possible.
Yeah, I guess that's for me for now.
That's wonderful. Thank you again, Alice and Hibbah, for your really great questions and wonderful answers. I mean, I always use myself as a case study. You know, I'm very open about my eating habits and the things that I do well and the things that I don't do very well. But one of the things, and I think, you know, what you said, Hibbah and Alice, I know you're so committed to supporting the people in Manchester to improve their first of all, to be informed about their nutritional choices. And we can't make anybody do what they don't want to do. And I think something has to click inside your head that says, you know something, let's stop. And I use the word stop fooling ourselves, because I always say I eat healthy, but I eat too much of it. I know that. So I've made a conscious effort over the last few months to reduce my portion sizes. I'm not great every day, and I'll still have my bit of ice cream, but I can actually say I've lost 12 pounds. It's been a slow progress. And you know, I've also, I mean, I'm being very open here. I've got underlying health issues, so I can't walk very far, but I've increased my stretching, they say calisthenics. So I've been doing more stretching and, you know, sort of doing the other versions of the exercises that Doretta does here and the other people do. You know, I do an alternative effort. So it's not always as much cardio in one way, but I do get my heart racing. So I think, you know, and I've learned so much. I mean, I was an orange juice drinker. I love a glass of orange juice, but I start to look at the bottle now and thinking, oh my goodness, there's so much sugar in that. So I will now add some water in it, so that I'm still getting my orange juice, but not with so much sugar. And that's because of the little tips and things that I've learned in the last few months. It's 6 months that I've been here. And so I can say that over that period of time, and I've not been on a diet, you know, so it's those small changes that are really making a difference to me. I mean, I have got lupus, and one of the things that is my bugbear about the lupus is my energy levels. I hate feeling tired. And I can say that my energy levels have increased. And that could be just because I'm now, as you can see, I've always got my bottle of water with me because I'm drinking more water. I'm not perfect, and I don't profess to be that in any way. I have my days off, and, you know, and I'll eat my lots of rice and my curry goat and all the rest of the things. But then I'll try, like you say, to get the calorie deficit the next day and think, right, okay, if I'm going to have that, I need to do a bit more walking. So I think, you know, I would really encourage people, you know, these little tips that are being offered to you, and these are available on YouTube and on Facebook, to go back and see them and help us to help you, because that's what we're all about. There are a couple of questions that are coming back in here. The question's been asked, Alice, have you got a private clinic that people can contact you directly? And yes, we're going to organise that for you, Hazel. So, but yes, I would really encourage people to just to listen and just, you know, even if you don't do everything, maybe just one thing, you know, and that could, you know, potentially make a difference for you. So.
And yeah, I agree with you. Thank you for sharing. Congratulations on your, weight loss. That's really good. I'm so proud. Woohoo! Yeah, so I just wanted to say that most of the time I get patients who they can't control their sugars. That's when they come. A lot of damage has been done. They can't now breathe. They have issues with their blood pressure, the cholesterol. They've been taking medications for a long time. That's when they come. But sometimes these people come when it's too late. You have kidney problem. In fact, they're trying to call me. It's an emergency. You need to see you. And I refuse. I say nutrition is not an emergency. I'm only available, like I've not been available for the last 2 weeks for private consultations. I'm only available from next week. So when you want emergency, then I know this patient has been sitting there and not doing anything. And then now it is too late. And we can't do so much because the changes don't occur in a day. Or like you're saying, 6 months you've been here, you've made the changes and it's occurred. So let's not wait. Personal consultations is so expensive. Sometimes I feel sorry for patients. They already have a kidney problem. They're paying so much for dialysis. They're paying so much for medication. And then I'm not going to reduce my fee because you have these complications. Then it becomes very expensive. So let's make an effort and start now. For all those people who are always here, thank you so much for being here. I think CAHN, you're really commended for doing this for the community. I wish the community can use this now because sometimes it can be too late, So I hope the people who are here are also making small changes and seeing effort. Hibbah has been sending me her plates every often, and I can confirm that the vegetable has increased. The sauces are a bit smaller, and the starch is also smaller. So, well done, my friend.
Thanks, Alice. Yeah, so I think I should also confess that we are all work in progress, all of us. Even we, the experts, also need constant reminders. So. As we go along, we'll be introducing a program that we are about to start. And I think I've talked about this before. I would urge everyone to be on board because that's the only way we can have a sustainable lifestyle change, working together with others. Like Alice said, I've started sharing my food every day. And, when someone sees what you are eating and then you have inputs on what you can change, it really helps. Okay, so in the next few months, I'm hoping very soon, we're going to start this tailored session where we're going to work in groups. We'll talk about it when we are ready. We are not, but I just want to encourage people that once we start, please come on board and engage fully. Come on board and engage fully. That's the only way we can really change our lifestyle and have sustainable lifestyles that could improve our health, that will improve our health and keep us healthy and fit. Thank you, Dr. Alice.
And next week, I think we'll be talking about water. Karen is always providing these ideas.
I love this because I feel like it's all been tailored for me, and it's not. It's just. But you are great and I think that's really important. And thank you so much for that, Alison, Hibbah, because I think, and I will implore people, if you ask us to find out about a subject matter or a topic that is dear to your heart, we will try. I think Alice jokingly said, oh, that's more reading, because that's what we do. We go away. If we don't know, we learn we will learn and we will share. So if you've got anything that you want to hear about, if you want to learn about things, please let us know. We will try our utmost, because this isn't just for me. It's for everybody in the community. So if you've got a family or a friend that you feel that actually they could benefit from listening, then do please encourage them to come along. Encourage them to watch the video on YouTube or on Facebook, so that they too can sort of learn something. Because I always say, it's that gentle voice, and I'm never great at remembering what Alice says, but it's that genes are the gun and your lifestyle is the trigger, something like that. Yeah,
you're very close. Jeans, load the gun.
Load the gun.
Yeah.
And you know, and that is so true, because when you talked earlier before about a family of, I mean, all my siblings are slim. I'm not. You know, I think we have a family joke that I could give them all a stone each. They'd not be fat and I wouldn't be skinny. You know, I would say I've got my mum's genes, I've got my mother's genes, and that's not, but I think it's also my lifestyle. You know, I'm not as good at keeping portions as they were. So we had the same food, but I'd be the one that would go back and have that extra helping, or I might not have been as much active as they are. And so there's things that, you know, that we really do, you know, that I've learned that, you know, and that, so when I make my choices, it's like, okay, really, Karen, do you need to have two spoons of ice cream? You could just have one. So you satisfy that desire, but you've not overeaten on that particular thing. So I do, you know, I really do encourage everybody to help to participate in this session by asking questions, contacting us at CAHN, so that you can, you know, so that we can sort of find the answers to the questions that you might have. Unfortunately, again, so thank you again, Dr. Alice and Dr. Hibbah, for all that you continue to do on behalf of Sahara Nutrition and CAHN. Thank you so much.
You're welcome. Thank you, and have a good evening and stay healthy. Remember, eating without taking drugs without eating properly is like washing your hands and drying them in the dirt.
Thank you.
So especially if you're in the community and you're taking medication for some condition, then you need to come so that we can work together to support you. Thank you very much. I enjoyed the session.
Thank you.
Yeah.
See you next week.
Bye.
Thank you, everybody, again, for joining us tonight. Unfortunately, again, we do not have a physical instructor, but we are working very hard to have Doretta back with us, or hopefully it will be Orlando or somebody that will be able to get you all active again. But we do appreciate that whilst we've got the good weather, I would encourage you, you know, we're not having a session here on Zoom tonight, but you can go out and have a half an hour walk. So please go out, take a walk, enjoy the sun, the late sunshine, and keep your heart pumping. Thank you so much for joining us. So just before I go, I want to remind you all that, as ever, we have our health hour on Saturday morning between 11 and 12:15. I encourage you to come along and, you know, learn something new about your health and how your health, you know, the things that you can do to make yourself well, and just to be informed about things that are going on in your body or things that could potentially go on in your body. So please do come along. We will have lots of events over the next few weeks. So we encourage you to keep in touch with CAHN, and we will try to keep you up to date. Thank you again for joining us for Healthy Hearts. Thank you. Bye-bye.